My name is Sona Shazad, and I work as a medical scribe at Cincinnati Children's.
My name is Zaka Khan, and I am a pulmonary and ICU physician.
Hi, my name is Pallavi and I'm a PCA.
I'm Abhishek and I work at Children's for my capstone project.
So I started working in April of 2021, and I noticed that there were some aspects of the job that were altered just to take into account for different safety precautions for COVID. And then one aspect of that I really noticed is normally as a scribe, my job is to follow the provider into each room. But whenever a patient showed any possible symptoms of COVID, like a fever or even just like a cough, I wouldn't be able to go into that room just as a safety precaution for me. So instead, I would have to sit outside in the hallway instead of following the provider, which did impact my job and being able to help them more efficiently.
COVID has been a very different disease and experience. I started working as a physician since 1997. So COVID has been the disease which we had to learn from zero. I started, so being an ICU physician, I had to take care of all the sick COVID patients when COVID first started. We had a lot of different things which were being, kind of thrown at as treatments, but despite every technology and everything else we had a lot of patients who were dying despite our best efforts. So that has been a very humbling experience because, and then we also, it was kind of scary times because, we had to take care of all the sick patients and we were trying to figure out how the disease transmits and how to treat it, and our safety and the safety of our families was also kind of at the back of our mind, because while we were treating all these sick people, we were getting exposed to and we had to do a lot of precautions and wear a lot of masks. So I think things have slowly been getting better. We hopefully have learned some lessons from how to treat pandemics, and hopefully this will help us treating our patients as we go forward.
I think definitely after the pandemic, all the PCAs or any like nurses and doctors, we've had to take more like precautions when entering and exiting patient rooms, especially when it comes to like washing your hands, using hand sanitizer, and the amount of like PPE we have to wear.
Yeah, so COVID, it kind of switched how we work. I work at the schooling department at Children's, so I get to tutor kids, and we actually had to switch to more online schooling because we weren't allowed into patients' rooms. And we also have to be more cautious when going into patients' rooms because of COVID.